Hi everyone, it's Sandy. Today I'm gonna be talking about new treatment called PrEP. According to our world in data, every year almost 1 million people in the world that die of HIV or AIDS. In some sub-Saharan suffering country, deaths per capita vary between 100 to 300 deaths per 100,000 people. In the United States, deaths from HIV are around 1.7 per 100,000. Most of these deaths can be prevented thanks to a new drug. The purpose of my speech is to educate people on HIV preventative medication, PrEP, also known as PrEP exposure prophylaxis. The end goal is to reduce the number of new HIV cases. I'm immersed in the field of public health as well as a nurse at a hospital. After hearing some doctors talk about it, I have extensively researched this topic to gain an understanding of it, including its efficacy, benefits, and implications for HIV prevention. This drug is not an end-all solution to HIV, but it's a step to reducing the number of new people afflicted with HIV. Today, I'll be talking about first, what HIV is, second, what PrEP is, third, the benefits and the side effects of this medication. So, let's know what exactly HIV is. According to CDC, HIV stands for human immunodeficiency virus, and it attacks our body's immune system. If enough time passes and HIV is left untreated, it can advance to AIDS, which stands for acquired immunodeficiency syndrome. When HIV gets to the AIDS state, known as stage 3, it's incurable. People without medication usually live around 3 years. According to Garcia and Guzman, CD4 cell count has become the best indicator of disease progression and is used to stage disease and guide medical therapy. Per the CDC, one of the indications for the diagnosis of AIDS is when CD4 cell count drops below 200. So people commonly get HIV from sharing a little or through contact with certain infected fluids. Individuals carry a significant concentration of HIV in their bloodstream and pose a high risk of transmitting the virus. People who get infected with HIV often have very difficult lives managing the disease and face shorter life expectancy. Modern medication has helped alleviate the symptoms of HIV, but no cure has been found. Here, look at those symptoms. So, like fever, mouth ulcers, swollen lymph, and sore throat, headaches, muscle aches. And we also have the death rate here, which I mentioned at the beginning. And so let's move on what PrEP is and how PrEP can help people. PrEP is HIV preventative medication. It does not cure anyone who's afflicted with HIV, but it helps their partners who are at risk to protect themselves from contracting HIV. U.S. National Library of Medication notes pre-exposure prophylaxis, abbreviated as PrEP, involves measures taken before potential exposure to prevent the transmission or control the spread of an infection or disease. PrEP can be in the form of a once-a-day tablet with a brand, the name of either Trovenda or this COVID, which I have pictures shows here. And these tablets are made of two medications called tenofovir or antracentabine. PrEP also comes in the form of an injection by the name of amplitude, which is taken every 2 months. A prescription is required to obtain any form of PrEP. So PrEP should be taken by individuals at risk before engaging in sexual contact with an HIV positive partner. PrEP medication do not replace condoms and they should be used to further decrease the risk of HIV. Before taking PrEP, it's best to get tested to make sure you do not already have HIV. If taken properly and proper precautions are followed, PrEP can help HIV-infected individuals live a more normal sex life with their significant others. PrEP reduce the risk by up to 99% in some cases. PrEP can also help those at risk of getting HIV from certain drug use. And now that I have discussed how PrEP can help protect from HIV, let's talk about the side effects. The common side effects we have feeling of nausea, vomiting, bloating, indigestion, diarrhea, headaches, dizziness, weakness, and difficulty sleeping. Various strategies can be employed to help individuals cope with these symptoms. So HIV-Gov claims PrEP is safe. No significant health effects have been seen in people who are HIV negative and have taken PrEP for up to 5 years. However, a small number of individuals using PrEP encounter severe issues. According to NHS, occasionally PrEP might impact your kidney function, which is why kidney assessments are conducted before and during the course of treatment. The likelihood of PrEP affecting your kidneys is higher for individuals aged 15 or older, particularly if they already have existing kidney issues. PrEP also might reduce your bone mass density. I have picture here. You may get osteoporosis, which means you lose your bone density. And here also, those are the percentage for the cases with both medication, which are Truvada and Descovy. And these effects should be considered before taking PrEP in any form. Consulting with your doctor before starting is important to make sure it's right for you. PrEP still needs more research done in the future. One should stop taking PrEP to stop most adverse effects on the body. Knowing overall transmission of HIV is benefit, but it's not worth taking if you are having adverse effects like what I mentioned, like kidney problems or bone problems. And the medication has been having some nostril cleanse here. Okay, now to wrap it up, let's review what we have gone over. We talk about HIV, PrEP, and PrEP side effects. First, HIV is a disease that weakens the immune system of our body and leads to death if not treated. People contract it from sexual contact, drugs, and certain infected bodily fluids. Second, PrEP treatment is a solution to reduce the potential of spread of HIV. It should be used alongside other preventative measures like condoms. There is more than one route of intake into your body, and there are currently 3 brands available. Third, I talk about the possible side effects one can expect if they take a PrEP medication, both common and severe effects. This treatment is not for everyone, but not everyone will need this information. I hope just knowing this will be enough to help someone else one day. And I have those reference here, so you guys can take a look at them. Thank you so much.